Viola Davis Brown was one of the first African Americans in Lexington, Kentucky to become a registered nurse. Her work in the civil rights movement helped improve public health and medical education in Kentucky. As a fellow nurse in a rural area, I'm grateful for her dedication to increasing the number of public health nurses in the state. Being a nurse means a lot of things to me. It means being a helper. It means being a carer. It means walking with a patient through the story of their life. Sometimes you get to be a paragraph and sometimes you get to be a chapter, but everybody has a story about how a nurse has impacted them in their life. And that's kind of the most remarkable thing for me about being a nurse. Well, personally, the hardest part of the last year is not having the flexibility to see my family and to move around. Professionally, I'm an addiction medicine nurse practitioner, and we always say that addiction breeds in isolation. COVID-19 was definitely a perfect storm for negative outcomes for my patients. We saw a huge amount of relapse. We saw a lot higher rate of overdoses than we'd seen before. Over the last several years, we've done a pretty good job about getting the opiate epidemic a little bit more under control, and COVID-19 completely destroyed all of that. I, as an addiction medicine nurse practitioner, tend to develop very close relationships with my patients. At the end of the year, when we were getting vaccines and people were starting to receive their vaccines, I had a patient come in that had just finished her 2 weeks after her second vaccine and was officially fully vaccinated. And I also was fully vaccinated. And so she got a lot of joy out of giving me the first hug that she'd been able to give me in a year. I decided to get the COVID vaccine as soon as COVID happened. I knew once we had a vaccine, I would be receiving it. I got it as soon as it was available for me in my area, which was the first dose was available for me in early February. So I received my first dose in early February of this year and my next dose in early March of this year. I decided to get the COVID-19 vaccine for several reasons. First, I'm a firm believer in the quality of vaccines and their utilization and their usefulness in a public health environment. Secondly, I got COVID-19 myself and had a fairly negative experience with it. It wasn't really a pleasant thing that I wanted to repeat again. So I decided as soon as it was available, I was going to go ahead and get it. If you're hesitant to receive the vaccine, I'm going to ask you several questions. I'm going to ask you what's holding you back. I'm going to ask you what your needs are and what your values are, and what is important to you in receiving a vaccine. I'm going to talk about safety profiles. I'm going to talk about trials, and I'm going to talk about the speed with which we came to develop a vaccine and not sacrificing any efficacy or stability or safety for this vaccine.